Ho, ho! It's that time of year again. Christmas is right around the corner, and you do not want to delay. Because of COVID-19, there are numerous logistics delays expected. Give yourself the gift of a true Christmas miracle by planning ahead with Miracle Brokers. Whether you're moving halfway around the world or ordering a new car for your loved one, contact Miracle today at 949-5989.
With a pandemic burning right across the world and now affecting us throughout the Cayman Islands, the aspects relating to healthcare touch every single part of our lives, whether it's going to the supermarket, queuing for the bank. We've all been there, we've all understood that. So as the Chief Medical Officer, it's been very important for me to try and guide and advise all the different aspects of people's lives as it relates to trying to keep them safe. Not only that, but at the same time, there's the issue of making sure that the hospitals are properly prepared, doctors, nurses, all the healthcare workers have the right information, the right training. And also to make sure that we're able to test and detect and manage accordingly any of the infections that arise. So it's been a very large portfolio of work, and it's certainly been one of teamwork, not one where any one individual is doing the lion's share, but very much one of teamwork with some people at the top, necessarily people like myself, other senior members of the civil service, guiding the process as we move forward. The Chief Medical Officer's principal role is to provide policy advice as the senior policy advisor to the government. So this means frequent trips to Cabinet, frequent meetings with senior groups in order to guide advice. But I don't work independently or on my own. I'm constantly seeking information from other members of the public sector, other members of the private sector, and also from expert groups, whether it be the World Health Organization, CARPHA, or the UK Health Security Agency, formerly known as Public Health England. I also am an avid reader of scientific articles and also the press in general to learn what the latest developments are. And all of those pieces of information fit into the guidance that's given. Guidance that's given for the Cayman Islands is necessarily Cayman specific. All countries have needed to follow their own path with regard to this pandemic, because you need to take into account the local circumstances and how the pandemic is playing out in your own country, and also what the local sentiment is for guidance, information, and what structures are available to manage the pandemic. As we've worked our way through the pandemic, it's with a constant eye onto the horizon and to our eventual reopening. So although we went into lockdown in March 2020, we have always had an eye on what the future would be. And unfortunately, SARS-CoV-2 has thrown us a number of curved balls, because the variants of concern have really complicated the scenario and made it even a harder job to get people vaccinated using vaccines that are going to be effective, and then, of course, now the booster rollout program. In order to provide specific protection for the pandemic, there needed to be a lot of regulations, policies, and protocols that have been written in conjunction with a large number of different people. Clearly, any regulations are regulations to the Public Health Act, and these are enacted by Cabinet. They have the right to write regulations in regard of controlling of pandemics and similar such issues. And obviously, the Chief Medical Officer and other senior healthcare officials will provide guidance to Cabinet about how to do this. Normally this is in the form of a cabinet paper which sets out the issues, sets out the rationale for why changes are being proposed. And the papers are circulated quite widely to different groups in government. I have their input before they're finally presented to Cabinet. And then Cabinet very often comes back with questions to the authors of the document in order they can be clear. And they may well decide on a slightly different path, or they will nuance what has been suggested. Being in medicine is always about a commitment to trying to help other people, whether in my previous role as helping an individual, and now in this role as helping large numbers of people. And everybody that's in healthcare has this sense of duty and purpose in order to improve other people's lives. So that's very much what brings me back to work every day, in order that I can continue to try to do my best to help as many people as I can, and to save lives wherever possible. I think probably my most inspiring moments have been the thanks from the members of the public. Just as I mentioned that I like to help people, that's why I've come into this role. It's very much having some feedback, and there's no more important feedback than coming from a stranger you've never met, coming up to you and saying, "Dr. Lee, you don't know me, but thank you very much for what you've done." Those instances have meant more to me than you'll think. I probably look like I've given a fairly bland response to you, but I've really taken those messages in. And it's not necessarily from people who are, coming up and talking to me in the supermarket or in the bank or something. It's also people driving down in their builders' trucks, giving me a toot on the horns and waving their arms out the air and saying, "Well done, Dr. Lee." I mean, all of these things have really made my life very rewarding, and I thank you for those.
Purell hand sanitizer products are available at reliable supplies. Contact us today for Purell hand wipes that are convenient to carry with you, or alcohol-based hand sanitizer pump, ideal for offices, schools, and homes. Contact Reliable Supplies today to get your COVID-19 supply at 949-9303, or stop by our showroom, centrally located off Compass Drive.